So we're gonna take some x-rays on this horse and we are putting on our lead apron so that we can protect ourselves from the x-ray machine.
Here in the fetlock area of the swelling that we see over there with the mineralization. So now we're gonna tell this owner that this horse is not totally lost. So, right here, this is a calcification of the bone, which is right here. We can see it right here. That big bone is a calcification of that bone. All right, that is the left. Now the joint itself is right here, and it doesn't look horrible. It has a little bit of arthritis, but it's not horrible. We're gonna deal with it. We can see the calcification right here as well. All right, now I'm gonna go and see the calcification again here. Now back in the days, seems like this horse had some bone bruising right here in the fetlock area. So that's what we call a lucency. And right here is a small spur. It's a small spur in that fetlock. And this is the flex view. Here we can see everything better. We have a calcification here by the sesamoid. These are the sesamoid bones. We have a calcification, tiny little spur right here in the sesamoid, and another calcification right there. Now on the inside sesamoid, it has a swelling over there. However, this sesamoid looks pretty good. We can see that he had some sort of injury a long time ago. But let's go to the right. All right, this is the right front. This is the fetlock. This is the pastern. This is the coffin joint. Right here we see a small spur. Right here we see some small mineralization. This one also probably had a little bit of bruising right there in the distal cannon bone. This was probably a racehorse back in the days. This is a lot of the swelling that we see over there. We see a mineralization here. We see some soft tissue swelling. Nothing broken at the moment. That's why he's not that lame. Those are small spurs, small mineralization in the fetlock. And this is the hock. There's a normal hock joint. This is the tibia, calcaneus, talus, proximal intertarsal joint, distal intertarsal joint, and tarsometatarsal joint. And this is the metatarsal tree, or the cannon bone. That looks pretty normal. Now we're gonna look at the right. Right here is the tibia, calcaneus, talus, proximal intertarsal, distal intertarsal, and tarsometatarsal joint. Easy, always the same. For millions of years, they have been right there and not change, which is pretty cool. It makes our job easy. They don't change. Good. All right. So now we're gonna tell this owner that this horse is not totally lost. We could do something for this horse.